Hello, everyone. Welcome to the CAYL Catalyst webinar series. I'm Valora Washington, CEO of the CAYL Institute, that's Community Advocates for Young Learners, and we thank you for joining this webinar series today. We offer these webinars on the first Thursday every month at 4 p.m. Eastern Time to give people in the early childhood education community a chance to interact with experts in our field, as well as practitioners across the country who are doing amazing work. We really appreciate your presence and active participation in these discussions. Today is the 52nd episode of the CAYL Catalyst webinar series, and I am so grateful to this team of very talented staff who has made this work possible and brought to you so many exciting conversations over the years. All of our webinars are free, recorded, and available on our website. We ensure that everyone has access to this information, regardless of their location or their schedule. At the end of the webinar, please click the link we're going to provide in the chat if you want to join a live Q&A session. After this webinar, you're going to receive an email with resources that will help you dig deeper into the important conversation we're going to have today. We invite you to stay connected to the CAYL Institute. You can learn more about our work by following us on various social media platforms, visiting our website, or watching our YouTube channel. We also invite and encourage you to support this webinar series with a financial donation. Your donation helps us to share these critical conversations in your local community and in the 65 countries around the world that listen to the CAYL webinar series. If you have a phone available, you can text the word CAYL to 53555 to make a tax-deductible donation. And as we hear from you, we're always learning so much about what the community is interested in learning about. That's why our theme for 2025 has been the way forward. Today, we're going to have a conversation that addresses the question, what is the way forward with children in poverty? So let's start by asking you to write in the chat and tell us, what are the ways that you think our communities can best support children in poverty? Let's hear from you. In our rapidly evolving landscape of public policy, many early childhood educators are seeking information about the policy's impact on children and what we can do individually or collectively to lead the way forward. We know that permanent change is going to require systems change, and that means change in structures, change in relationships, and change in our mental models. So we hear educators telling us they're worried about children in poverty, and they're concerned about the impact of poverty on educators themselves, since about 13% of early childhood workers themselves live in poverty. Child poverty refers to a state of children living in circumstances where they lack the resources to meet their basic needs. Yes, this is a global issue with significant consequences for children's health, education, and future opportunities. But today we aim to talk about and increase our awareness about children living in poverty in the United States. We're going to begin by asking the fundamental question. What do we really know about children in poverty? And before today's webinar, we asked the CAYL community, tell us what's on your mind regarding children in poverty. And the CAYL community told us that they wanted answers to questions like these. How is poverty actually defined and measured these days? How prevalent is child poverty? And exactly how many children are growing up in poverty right now? What's been the impact of COVID on child poverty? And you want to know how poverty is affected by factors like race or family structure or the availability of childcare. The big question that's on your minds is, what are the consequences of recent federal legislation on child poverty? And how can we support children and families now while we continue to work for systems change? So we are very honored today to present to you two of our nation's leading scholars and experts who can address these questions. Both of these leaders are from the National Center for Children in Poverty. Sheila Smith is the director of the National Center for Children in Poverty. She has decades of experience as a researcher with a special interest in strengthening early care and education programs that serve vulnerable children. She's also been working for decades to help policy use the information that we learn about young children. Karen Chatfield is the Director of Family Economic Security and the Associate Director of the National Center for Children in Policy. Her research is focused on the outcomes and how U.S. social programs and policies are supporting development in low-income families and communities. So I'm going to begin by asking Sheila and Karen to join me on screen as we begin to talk about these important questions that you have been raising in the CAYL community. So welcome, Sheila. Welcome, Karen. We're so delighted to have you with us. Just thrilled to have you.
Thank you.
I want to know if you can start by sharing with us just some basic facts about children in poverty. People are wondering, what are the facts about children in poverty in the United States today?
Yes, thank you, Valora. I'll take a stab at that. There are various ways of describing child poverty, and in particular, there are different numbers that we use, and I'll start with those and then move into something a little different. These numbers include the official poverty measure that uses the federal poverty level used to assess benefit eligibility for many programs. And then there are supplemental poverty measures that also account for the resources that low-income families can gain from benefits like SNAP and TANF and Medicaid, housing vouchers. In general, the supplemental poverty measure, or SPM, is often lower than the official poverty measure because these benefit programs are overall fairly effective in providing families with significant resources in addition to their income. So the proportion of U.S. children, according to the latest figures we have, that we're living in poverty in 2023 was 13.7%, according to the SPM, and we'll be getting the new number for that for 2024 in a few days. But I'd also like to talk about this a little more broadly because at NCCP, we think it is important whenever we're discussing child poverty to consider whether families are able to meet all of their basic needs in areas like housing and food, medical care, transportation and utilities, and their basic work and education expenses for both adults and children, including higher education, and let them have an ability to put some savings by as well. So even while receiving all the benefits for which they're eligible, the truth is that many families continue to experience deprivation of various kinds. And some people have turned their attention to this very helpfully, and there are various measures of what families with children need to thrive, not just to survive, but to thrive. And some of these measures are location specific to account for the local costs of childcare and housing in a particular state or county, for example. And there's a very helpful framework some of you in your audience may have heard of called ALICE, which stands for Asset Limited, Income Constrained, Employed. And it describes families in which caregivers are employed, but in order to make ends meet, they are frequently making trade-offs to pay for one basic need in place of another. So if I'm a parent under the ALICE threshold, perhaps to pay for my childcare, I have to take on some debt in order to meet other basic needs, just to pay my rent and my utilities and so on. So that's just an example. The United Way works on measuring the numbers of families that are living under this ALICE threshold, and they have recently told us that there are 42% of U.S. families with children living in the circumstances of making either less than the official poverty level or being so income constrained that they have to make these difficult trade-offs. So that's more than 2 in 5. And I think that's a very important number. I'll add one more, which is that more broadly, the Urban Institute recently provided a national assessment that assesses what they call the true cost of economic security for families. And this suggests that about 60% of families with children in the US fall below their threshold today. And about 1 out of every 10 US families have less than half of what they would need to reach their threshold in order to truly thrive. So importantly, what it takes to really be without material deprivation and to thrive varies across different areas of the country, and there are urban, rural differences that are very important. But so I don't want to provide you with specific income numbers, but I do think there's a prevalence of what we think of as deprivation, and parents experiencing a lot of stress, obviously, because of the really impossible trade-offs that they must make. And I think that's very concerning. And also, it seems to have continued as we've come through the pandemic.
Wow, I think it's really interesting because that number seems to be jumping from 13% all the way up to 42%. That's a huge difference.
Yeah, I hope that's not confusing. I mean, I think that what Sheila and I think about a lot is, really what's going on behind the scenes in creating these different measures. And, the SPM was thought of as a leap ahead of the official poverty measure. But I think I think it is important to account for the transfers that families are actually getting, things like SNAP and WIC, and to acknowledge that those programs are important and that they do help people. But it's also important to acknowledge that costs have gotten so high for so many basic needs that in order to truly thrive, that doesn't quite do it either, and that we need a more generous framework.
Mhm. I love the way that you are really pointing out how poverty and what income it takes for poverty would vary so significantly across states. For example, in our office territory of Boston, Massachusetts, people might think that the amount that would account for poverty, what it takes to live in Boston, would be so much more than in other areas of the country. And these things, how are those things taken into account?
Well, as I said, there's a lot of magic that goes on behind the scenes with some of this, and a lot of data collection from state agencies. There is some reporting that certain state agencies do to federal sources, or they have done, for instance, with housing costs. That's very helpful in calibrating this, but it's work that's never done. It's as soon as people feel like they have a good accounting of, for instance, childcare costs, which can vary really widely within just one state, then they'll say, but what we really haven't accounted for is Medicaid. And in general, medical costs are kind of a very high bar, in order to really get both the supports that Medicaid supplies for people, and then the ever growing costs of medical care for young and old, and how that's changing across the states very quickly.
So you mentioned COVID. So I think that people are asking, can you tell us about how poverty was impacted by COVID? I think there's been some information in the public about how COVID and special um, expenditures around COVID impacted poverty in a very different way. Can you share that with us?
Yes, I'm happy to. As we all remember all too well, initially in 2020, there was the dramatic increase in unemployment. And so there were some additional supports put into place to assist families with children. And in particular, I think of there were certain pandemic payments made that year, and increases to SNAP benefits for nutritional assistance were quite important. And in addition, there was a necessary loosening that many of us were really happy to see, of some administrative rules and barriers that tend to restrict access to help for families, even in other times. So an example was this ability to apply for and get recertified for certain benefits without time-consuming in-person visits to administrators. There was a lightening up of that, and that was helpful to families. As pandemic conditions continued into 2021, We saw the passage of the American Reconciliation Plan Act, or ARPA, which provided, I would say, more forms of relief, including for families and young people working to increase their educational level. It became easier for them, for instance, to get SNAP. And then, of course, there was the expansion of the child tax credit, which I probably like to talk about too much. It provided a significant monthly per child refundable credit directly to all families every month, regardless of income or employment. And this reduced that supplemental measure of poverty, child poverty specifically. It had been 12.5% in 2019, slightly lower than it was in 2023. It decreased it to just 5.2% in 2021.
Wow.
However, once the expanded CTC had fully expired, by 2022, child poverty increased back up to 13.7%, as I mentioned earlier. And I also want to add again, to get away from just, numbers, that it's really important to note that even with these additional supports and programs, so many families struggled, especially during 2020 and the first half of 2021. In so many cases, parents and caregivers lost their jobs or forced to work for very low incomes. And so some children experienced what we call deep poverty, when income falls below what's 50% of that federal poverty level. And that's a very low subsistence level. And yeah, I just mentioned parenthetically here, I tend to focus on the SPM, but the official poverty level is still an important measure and has good uses. But deep poverty, which often affects those in immigrant families or those who are just very disconnected from social networks and pathways to assistance, is extremely challenging for caregivers and can be really difficult for children and have long-term effects. And we're quite concerned about it. Our research and that of others suggests that parental stress especially increased during this time for families in low income and moderate income households. It was a
Mhm.
time of such uncertainty. And as inflation increased for the basics like food, utilities, and housing, and unemployment opportunities were shifting, I would say, and often, less secure, with businesses sometimes closing down and entire industries changing their models. Low-income caregivers continued to feel anxiety about their family's economic security, even as things, gradually did improve somewhat. And it has been shown that parents' self-reported levels of anxiety and depression increase on average with the number of basic needs that they either cannot afford or struggle to afford on behalf of their children. And these levels of anxiety in adults in response to uncertain financial conditions, as we've seen, along with other researchers, result directly in challenges to children's mental health and social behaviors, including in the ways that challenge their learning in school.
But from a policy perspective, what did we learn from these lessons in poverty, as a lot of the transfer payments did increase and they did have an impact in reducing child poverty? How have we continued to apply those lessons to support children today?
Well, I would say that it really shows that when we have the political will, we can do something, about that. And I think that that is a very hopeful note. But as I mentioned, the child tax credit expired and we have kind of rolled back a little bit. I know you mentioned that, your listeners want to hear about this latest legislation this summer and what we sense is coming. We do in this sort of research community, we continue to hold that it is entirely possible to change the conditions that so many children and families are experiencing, and in fact, to wipe out child poverty. It is possible to do it, but we have to change the narratives around how we as a society think about these problems. And I could talk about those all afternoon, but I'm going to stop here for now for your next question.
Yeah, I was also curious to hear that I think many people in the public have a sense that children are poor because their families aren't working somehow.
Mm,
That
no, that
I wonder if you could talk to us about parental employment or caregiver employment in the context of child poverty.
Yeah, I think it's really a very very important discussion. And that's part of what I mean by perhaps changing the narrative. There's some very old stories out there that kind of, we kind of want to separate children from their families and maybe just help the children or just focus on getting them educated. And the picture is really so much more complicated. So, there are poverty is very strongly related to low levels of educational attainment in adults. On average, it's far more likely for a parent who hasn't graduated high school to be raising children in a low income household. But that doesn't mean that they're not working. And, what we've seen over time is that, there's this kind of maybe a bit of wage stagnation. If we look, as my team is looking fairly closely right now at minimum wage legislation across the states and, kind of all the loopholes for that, there's just a lot of caregivers earning very low wages. And as I said, the costs are just really going up and up. So there is this strong relationship that I think is only getting stronger between parental education levels and family income. However, it's not easy to change your parental education level while you're parenting, while you're earning an income, while you're really making trade-offs and coping with difficult circumstances. So I hope that answers your question.
Mhm. And Sheila, I'm wondering too, I think in addition to this idea that children are poor because they aren't working, there's also this idea that children are poor somehow related to their racial background, their ethnicity, their family structure, perhaps access to childcare. What have we learned about all of that?
I mean, we know absolutely that children of color are disproportionately represented among low-income families, and that we have a whole history of limited opportunities for those families. Going back to what Karen's talking about in terms of, our history of racism and housing discrimination and limited educational opportunities. So that really presents a very large historical factor that, we as a society need to continue working on um, and focusing on in all of our programs and policies. Um, we know that childcare is certainly not accessible to all families and has a very direct, immediate impact on limiting workforce participation. Many low-income families are not working as much as they would like to because they're working in jobs that have irregular hours or unpredictable hours. They don't know from week to week how many hours they'll be able to work or when those hours will occur. So that not only negatively affects their income week to week, but also their stress levels and ability to just plan, their caregiving for their children. So I know a little later we might talk about childcare workers, and you alluded to the high percentage of childcare workers who experience material hardship. So that's a very good example of multiple negative effects on the workers themselves and the children they care for, their own children and the children in those centers. I think it was Berkeley's Center for the Study of Child Care Employment that came out recently with findings that show that 43% of child care workers receive public benefits, Medicaid, SNAP, and other public benefits as a result of their very low wages. And of course, the stress of financial hardship is on top of the experience of usually very often very challenging conditions in the workplace for child care centers where child care workers may not, and I know your audience knows this very well, but they may not be able to take breaks for even
Mhm.
lunch. They work long hours and often don't have benefits in those jobs and work with children who may have lots of challenges. So there are these particular, groups, very large groups of workers and families in our society who are disproportionately experiencing a lot of stress and hardship.
Well, of course, we all know that poverty isn't good for kids, but I'm wondering if you could give us more specific detail about the consequences of poverty on children.
Well, yes. I mean, I think that what's really striking is that, simply put, it's just far more likely, if a child experiences poverty, material deprivation during their childhood, to have health challenges, attain lower educational levels, perhaps to even drop out before graduating high school, and to earn less throughout the course of their adulthood, which is so deeply unfair. So we see, that their cognitive and social emotional outcomes are affected by poverty quite early in childhood, well before school starts. The prenatal to three period, as it's called, it's a highly vulnerable time for children in their development. And so even when very young children can't articulate the challenges that their families are facing and don't understand them, their biology, their entire being and their outcomes are inevitably affected by these earliest experiences. There are remedies, as we know, and excellent care, early care, and education really does help. And yet, children do continue to be affected by challenging conditions at home in terms of their school readiness when it's time for kindergarten as they grow. And so there's just a large body of research showing that schools make a very positive difference on average to helping children to catch up from this early deprivation. But then there are these additional challenges. And, every summer there's what's called learning loss for children, possibly from some households, and they lose ground in comparison to children from the high income families who tend to have a lot of enrichment activities arranged for their children during the summertime. So it's not just what happens early on, although what happens early can have these especially strong consequences. And we also see that children are very vulnerable at older ages, as well as in different stages of development. Specific types of hardships will affect children especially strongly, and we're still learning about that. So, food insecurity or hunger is one of the greatest challenges for both children and their caregivers in these low income and even moderate income households these days. And recent research into the intergenerational persistence of food insecurity was so interesting to me. It suggests that there's a 10% greater likelihood of an adult being food insecure if they experienced food insecurity as a child. And this is over and above sort of the economic mobility and the income relationship from child to adult. So it's always important to realize that there are multiple sensitive periods or vulnerable times, and we're still learning about the connections between certain kinds of early experiences for children in poverty with particular outcomes, as well as how to remedy them.
Yeah. Let's just say that, many programs, the war on poverty that I think the three of us remember and have lived through, which really
Mhm.
many programs were established to interrupt the cycle of poverty. For example, we know that Head Start has done a lot to interrupt that cycle of poverty. And isn't this the American dream? I mean, the American dream is telling me that one can have social mobility, that each generation can do better than the next. I'm wondering, are we still dreaming that? How is the American dream holding up in
It's
terms of
it's
social mobility?
Yeah, I think we really are seeing a period of where it's been very taxed. I mean, certainly I grew up in a period where I heard a lot about the American dream, but I think part of the problem is that maybe that was considered sufficient by many. The idea that Americans experience maybe sort of a level playing field, more or less, and that even children who grew up in poverty could have a better future merely through educational opportunity and consistent effort. That was maybe very appealing. And it may have been even more seductive in a period when there was a less regressive tax structure and different economic opportunities than those that exist for people today. Um, Even so, I would argue it wasn't really accurate. If we look honestly at our past, We know that this dream was not always equitably available to everyone, and that race and poverty have long been deeply intertwined. You've already asked about that. It's just, I think that the beliefs and stereotypes that have served to diminish potential economic mobility, they still, for certain people in particular, have been enacted very broadly. There have been these kind of fragmented social assistance programs that, as important as I believe they are, even today, they can trap families in poverty rather than really boosting them up and out. And um, for those that do manage progress, I mean, I'm truly in awe of people's resilience and determination and creativity in managing these difficult situations. But I think that what we're seeing today is that more and more groups are experiencing these sort of decreasing possibilities for mobility and advancement. As educational attainment has grown out of reach and high wage employment has become more tied to higher education levels than ever before in recent years. And I'm sure your listeners are aware that there are political implications for these shifts in ways that I'm not going to get into today. But I think the so-called dream, it's still important, and I still hold it in my heart, but I think it has become less attainable for many.
I'm wondering if you could say a little bit more or expand more on your comment that people get trapped. And can you say a little bit more about what you mean by that?
Yeah, I don't know. I don't know if I could do it without my pictures. I have charts and graphs usually for this talk, but one of the specialties at NCCP, long before I began working there 2.5 years ago, is that we have a consistent focus on benefit cliffs. And what's kind of nice about benefit cliffs is that um, people from the left and the right politically really agree that they are a terrible problem.
What
So
is
a
the
benefit
benefit
cliff,
cliff?
it's when someone earns more money and they they're actually worse off because they lose resources. Possibly they lose a benefit entirely, like maybe they just don't qualify for SNAP anymore or childcare subsidies anymore. That's the big one. They both of those can be quite large, or even just sort of the benefits tend to taper off. And so families often feel like they go off of a cliff and they will actually say, wait a minute, I can't take that promotion. I can't earn more money. And that is what I mean by trapping someone. I don't mean to imply for a second that people are ever lazy or that they don't want to work hard. That has just not been my experience or my finding, but I think we're all human. And if you're going to, lose as much as we see it, like families will lose $15,000 if they have a couple of children and they lose childcare subsidies. And I don't just mean in the loss of the subsidy, but just, everything's always changing. They're going to pay more taxes. They're going to see fewer benefits, and they actually lose out sometimes. And that's a big problem that we spend a lot of time working locally with states and governments to kind of look for solutions to. And it's really saddening that we haven't fixed that yet, and it is a big problem.
So just in simple language, what you're saying is that if someone takes a raise, the amount of the raise isn't covering the amount of the loss when I get off these benefits.
Thank you. Yeah, that's much better than what I said.
Yeah, no, so yeah, it's very curious. What are some solutions when you're working in various states? I know that both you and Sheila work in a number of states to try to address many of these difficult questions. What are solutions that work to help people avoid these benefit cliffs?
Well, yeah, I think the benefit cliff problems, they really do need to be carefully addressed, often by legislators. Sometimes administrators of benefits can see options where they can give someone, for instance, someone at a very low income level loses TANF. Well, more and more states are saying, we'll give you transitional benefits for a few months until you really can pick up some more hours at work, and you're not going to experience even a small cliff at a very low income level is really, really painful. For some of the bigger cliffs, like for SNAP, many states are what we call BBCE states, or they follow what we call broad-based categorical eligibility. I'm sorry about all these acronyms, but it means that if states will just lift their income eligibility threshold up to 200%, then the benefit it will naturally just kind of taper more, and it will make the cliff, if not go away completely, it'll make it much more manageable if families can just stay on that benefit a little longer. Same for childcare subsidies. We're seeing some states lift up their income thresholds for childcare subsidies to, 2, 3, 400% of the federal poverty level,
Mhm.
and that's very helpful.
What are the reasons for resisting those types of policy changes?
Well, that's a good question. I think there are, in different communities and different circles, there is resistance to being more generous with benefits in general, and it's sort of letting families have them. I mean, one, I think, real concern is that, for instance, for the childcare subsidies, was speaking yesterday with someone from Vermont where they're really extending that threshold up. And I said, is there any, I know there's concern, and it's valid concern, that truly low income families will be pushed out and won't be able to access those subsidies, for which we don't have enough anyway in almost any state. There's sort of a real there have been wait lists in the past, and we don't always have enough childcare subsidies to go around. So that's a good, valid concern. But I think often sometimes there is a sort of thinking that you touched on earlier, where there's a belief that if people have too much help, they won't work hard. And then, we can't get workers, and our economy will suffer and stagnate. And they see these things as inextricably linked, and they don't necessarily understand the very real deprivation that can go on for households without sufficient benefits.
Mhm. Your thoughts, Sheila?
Well, I was just going to add that it's ironic, that view, isn't it, that this will be a disincentive to work, since certainly childcare is absolutely necessary for work effort. So the last thing you want to do is reduce access. Having enough food and knowing your children have enough food is certainly vital to good health. Access to health care and good food means that you feel well enough to work. So all of these things are really, at the center of anyone's capacity to be active in the workforce. And I think that maybe needs to be part of the change in the narrative. And I think that is happening in some states where, investments in childcare expansion, including state dollars, or in pre-K and extended daycare, that lets parents, have a full work day. I think that it comes often from a recognition that the state economy will be better, in addition to, it being very helpful to individual families.
Mhm. Well, so that we can be encouraged, I'm wondering if you can tell me a few examples of states you've worked in that have made these specific changes, and if you have any data on the impact or outcomes of those changes, those policy changes, once they've been made.
Well, I can talk a little bit about how gratifying it's been to work with advocates in certain states that have been able to just explain this shift upward for SNAP in particular, and just kind of, showing a chart or two to their legislators. As I said, everyone really kind of agrees that benefit cliffs should be done away with. And that has led to this increase in eligibility in some fairly, um, you know, red and purple states, we'll call them, states where you wouldn't expect them to want to be more generous to families. And I will say, I don't have real numbers on the number of families in those states that have newly qualified, but it was very gratifying to see those changes. And overall, across all the states, I believe that something like 17 million people qualify for SNAP thanks to these BBCE expansions.
Mhm.
Because I know that in 2017, there was an effort to sort of remove that possibility for the states, and that did not go forward, fortunately. And I noticed that even in the latest mega bill, that's not something that was attempted. They seem to not want to touch BBCE.
Mhm. So you mentioned it, the new mega bill. You mentioned it first.
Well,
Let's turn to that. And,
okay.
because we've all been watching, I think many people listening today have been looking at recent legislation and really wondering when it really goes into effect, what is going to be the impact on people generally, but in our case, on children in poverty. What are you anticipating? And what are the specific things that people might be paying attention to?
Well, I think that there have been a lot of good efforts by various organizations to put out specific estimates of how they think families and children will be impacted, and it will, of course, have some very serious consequences for some of the most serious anti-poverty programs that I could discuss. I mean, I I would say SNAP and the EITC are two of the most significant, anti-poverty programs. And it seems for the time being that the EITC has been left alone. So, I mean, you mentioned hope. I think that is a good sign. And I love the EITC, and I can talk about that for another half an hour at some stage if anyone would like
Mhm.
that. But I do also have to say that this is going to present some challenges to children's well-beings. We wish we could put this in a more positive light, but the cutting of the funding, particularly for SNAP and Medicaid, together with stringent new work requirements for parents and others who contribute to families' well-being, right? It's not just parents and caregivers, it's anyone really. And they're instituting harsher work requirements for SNAP, for instance, on veterans. So, if you have a grandparent or a family member living in your household whose SNAP benefit actually comes through and helps the whole family, they may lose that. We just know that work requirements, as they're generally instituted, it's really not about making sure that people are working and contributing. It is really more about these kind of administrative barriers that I alluded to earlier, that the work requirement is a barrier. And that often it is very difficult for a family, for even working parents, to come up with the documentation and submit it on time, and so on and so forth. And so it's going to be very easy for parents to lose their SNAP benefits if they are deemed, not in compliance with work requirements, even if they really are. We know that more children as a result will suffer from food insecurity, also unmet medical needs. We're very concerned about the way that the Medicaid changes are rolling forward. We all probably have heard the statement, which is true, that most people on Medicaid are working. Most people who are not children. But there are high numbers throughout the country of children relying on Medicaid. And so we are very, very concerned about all of these reductions. And these programs, I should also add, are administered at the state level, and there are going to be huge new sort of administrative burdens on the states themselves as they administer to families and children. So they're just sort of, it's you've heard of a win-win situation. It's a lose-lose, because whatever burdens the administration of the programs is going to end up burdening the families. And I think we have to say there are going to be related financial contractions in the communities where families live. So many local farmers and food distributors currently rely a great deal on SNAP spending in their communities. And they're gonna be seeing less of that. And it's also unclear, as it's been covered in the media, whether and to what extent rural hospitals will receive enough support to continue to operate. There's so many aspects of this that continue to come to light. It is very concerning, but I will say I'm encouraged by how many people there are who are observing this very closely, and how many state level actors, legislators, the like, are working on creative solutions to move money to where it's most needed. That gives me some hope, and I don't know if Sheila has some thoughts she wants to add on this.
I mean, I think, as Karen said, the barriers to families to just staying enrolled in programs that they are eligible for will be much greater. And so one thing states are thinking about doing is just, ratcheting up their efforts to find ways to connect with families about new requirements and what they need to do in very, concrete terms. And you can imagine, I mean, everything that we all do when we're getting a driver's license, we have to go to the DMV and read the list of requirements. And now with the Real ID, I was trying to understand, exactly what I need from list A and list B. Well, it's the same thing with public benefits. And so states really are thinking about ways to assist families in meeting these new, quite onerous requirements. And that is one thing I think that, the early childhood community can also participate in and sort of keep an ear out to the human service organizations, community-based organizations, which include early care and education programs, and really looking for opportunities to play a role in helping families keep their benefits.
Mhm. People in the chat are really asking about how they can communicate this to legislators. For example, you were talking about how people often think adding work requirements is a good thing, and it may not be a good thing. How do you talk to somebody to say the work requirement is not a good thing? Do you understand the challenge of this? What is some messaging that you can recommend that has worked in states that you've done business?
That is such a good question, and it's something that I think about all the time as I talk to advocates in different states with different climates and different audiences. There are different needs met, but one thing is to use very clear language, and to call work requirements barriers to access, for example, is may not be a bad idea. To really point out always when you're talking about work requirements, that very high percentages of parents and caregivers on Medicaid are already working, and that this is unnecessary. I don't know that we can um, change this back overnight. I think that we're going to have to go forward to it, but in terms of talking to legislators to let them know how very unfair it is and how additional resources are needed to lift up families and connect them, as Sheila was saying, I noticed Pennsylvania's already rolled out a new website explaining the SNAP application process to families. We all need to get out in front of this. And I think using very clear language, that really helps the legislators themselves understand what's happening. Also, narratives. I think the power of storytelling is very real. I was on a call yesterday with someone from Alabama who's really been very effective in preventing certain harmful legislation to families' economic supports in recent months. And she was giving examples that really worked for her. And one is coalition building. So you have, a number of voices, and then you figure out what stories are going to work. And it's not a bad idea in whatever area you're in to kind of poll and to figure out what are the stories. So it may be that, your legislators have heard too much already about child poverty, which makes me sad to even say. But sometimes people will respond if you point out that the new SNAP work requirements are targeting veterans as well, and homeless people and other groups like that who were previously exempt from the work requirements.
Mhm. Mhm.
I would just
Go ahead, Sheila.
briefly add that in every state, there is at least one, often a couple child advocacy organizations. And also, I know your audience is aware of the local affiliates of organizations like 0 to 3 and NAEYC. And I think those organizations are increasingly bringing in parents and providers to tell their stories. And I agree with Karen that these narratives, especially firsthand accounts of individuals who may be working, but just out of, lack of information or lack of time, couldn't make that recertification for their benefit and they lost it, and what happened to their family, the increase in stress, the loss of coverage of medications they needed. So the specificity that can be communicated about the hardship and the unfairness, I think, is very great when you have parents' voice and providers' voice really, at the forefront of some of these discussions directly with legislators. And I think these advocacy organizations and other early childhood organizations will play a really important role.
And remember, on Monday, we'll be giving out to everyone who registered some resources where you can dig deeper into this conversation. I know that a lot of abbreviations have been used in this call, so you can learn more about those, and really think about action that each of us individually and collectively can be taking as we seek systems change. I'm wondering if you, in the brief time that we have, can specifically narrow in on the impact of poverty and child poverty on our workforce, because as you pointed out, so many people in the early childhood education workforce are resource limited themselves, and they're working with children who are then resource limited. So I'm wondering if you can share information with us about that.
Sure. Well, as I mentioned before, this new report is showing that 43% of the childcare workforce receives public benefits, and that tells us quite a bit. And we know that low wages and the stress of economic hardship is really driving the high turnover in childcare centers and other early care and education programs. And turnover creates enormous stress and limits, early learning in so many ways. So when a teacher loses her assistant teacher or co-teacher and the whole center has to scramble, and the director who is really there to provide supports to her teachers can't do that because she's spending all her time doing interviews. When teachers who have these strong relationships, nurturing, supportive relationships with children and with families, has to leave that position because maybe she can earn more in a retail setting or even McDonald's. Um, all of that is disruptive to the early learning that should be going on, the social emotional development of children in those settings through those relationships. So the low wages and just financial hardship has so many consequences. And the last thing I would say is it is just, completely unfair to our early care and education workers to impose that stress on them. So I think, we're beginning to really see some stronger efforts. There's a new federally funded center that is focused on the early care and education workforce and will be promoting some new strategies. So I think all of us need to pay attention to what that center is doing and to local efforts to bring in the business community and others to try to raise wages for early care and education workers.
Mhm. Well, we all have a lot to do to try to hold on or maybe make the American dream really true this time. And so, I know there are lots of questions in the chat. I really want to encourage everyone. We will be putting a link in the chat that you can join a live Q&A session with Karen and with Sheila immediately following this webinar, and you can bring your questions to the after party in just a few moments. I'm wondering before we go, if you all can talk a little bit about how your organization might support people in our audience who are working at the community level, and many people in our audience are also working at the state level. So how might you support and engage with people with the information and resources that you have?
I'm so glad you mentioned that. So almost all of our work is done in partnership with state and local folks, often groups of people who are inside government and outside government, including advocates, providers, and parents. Increasingly, those are our partnership groups when we do research or bring research to discussions about policy options. So there might be opportunities for us to work directly with you. We do a lot of technical assistance locally and to state level groups. In addition, there's a lot of information on our website that, of course, is free for the taking. And that includes information about family economic support policies, state by state information about early care and education policies and parenting policies that affect parenting supports. So we would really welcome everyone visiting our website. It's www.nccp.org, and just kind of delve into our resources. And of course, we would always welcome any direct contact if you want to reach out to us with particular questions.
Yes, and your email contact information will all be provided in the information that we provide. This is a conversation that we'll all be having more of in the coming months as new policies begin to unfold and we begin to see the impact of it. So we really encourage the entire CAYL community to learn more about the kind of social programs that are supporting children and families who have financial needs, and to learn more about how we can be part of the systems change that is so required. Thank you, Sheila, and thank you, Karen, for this introduction to this important conversation, and we look forward to connecting with you more.
Thank
For
you
those
so
of
much.
you who want to connect with Karen and Sheila, join us at the after party by clicking on the link in the chat to join our live after show. And we also want to encourage you to join us next month as we are going to be talking about a very important conversation, and that is the question of immigrant children. We have a very distinguished panel of people who are working on the ground as well as in the policy arena to really talk about what's happening with immigrant children and their families right now. And as always, we thank you for joining the CAYL Catalyst webinar series. It is always our pleasure to have you with us. Thank you so much for joining us. See you at the after party.
Thank you.
Goodbye.